Good evening. I'd like to welcome everyone to this special meeting of the Loveland Board of Education. Let me ask first, before we go any further, can you hear me in the back of the room? Thank you. All right. I would like to call this meeting to order at 6:04 p.m. and ask our interim treasurer, Mr. Giuffre, for a roll call.
Mr. Dougherty.
Here.
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 Mrs. Washburn.
Here. All present. The first item on our agenda is to adopt the agenda for this special meeting. I need a motion to adopt the agenda.
So moved.
Mr. Doherty moved. Is there a second? And Mrs. Washburn seconded. You have the report on the meeting, and you have in board docs the face covering policy. There are no other items on here. If there are items to be added to the agenda, we will need to move to amend the agenda at some point. So are there any questions about the agenda at this point? Mr. Giuffre, can we vote on that?
Dr. Lewis.
Yes.
Ms. Pettit.
Yes.
Dr. Schweitzer.
Yes.
Ms. Washburn.
Yes.
Mr. Dougherty.
Yes.
Motion carried. The first item on the agenda is a superintendent report concerning school opening and consideration of face coverings mask policy. I believe that Mr. Broadwater is going to make a report. There are, I think, slides that go along with his report. And then after the report is done, that presentation will be posted to board docs.
Correct.
Mr. Broadwater.
Thank you. Good evening, everyone. Before I get into the face coverings and mask policy, I first want to talk about school opening. We had a great school opening. The part of the job that we absolutely love is seeing kids and seeing all of our teachers coming back. And I just want to say thank you very much to our bus drivers for getting our kids to school, for our school resource officers with all the traffic. The first few days getting that figured out can be pretty tough logistically. I want to say thanks to food service, paraprofessionals, custodians, maintenance did a great job of getting the buildings ready. And of course, our teachers did a fantastic job. I was able to visit every single building this week numerous times, and I just enjoyed seeing what we do for kids. And I can tell you that I am proud to be a part of this school district because of our staff and what we do for kids. So with that, I just want to say thank you to all of our staff for making it such a great opening. I want to move into, I have a presentation that I'm going to go ahead and share. And to get there. Hopefully we're there. Can everybody see that?
Not yet, Mike.
No? We are sharing the screen. Got it?
There now.
Okay. So starting with the first slide, got it full screen here. I apologize. Okay, here we go. So the first slide, just a quick review of the policy that we have right now. It's current policy 8450.01. It's the use of face coverings and masks. It reads in part, unless required by additional mandates, the decision to wear face coverings, masks on school buses, in school grounds, or at other school events will be left to adult individuals and parents, guardians of K through 12 students. The board work session that we held August 10th, we did go through the policy. We did not change it, but we did know at some point we would be coming back to revisit, and here we are this evening. So part of looking at the data and where we are, we finished our first week with our kids. Doesn't give you a whole lot of data, but it is a good point. for us to take a look and see where we are. But the Tuesday news conference with Governor DeWine and Dr. Vanderhoff of the Ohio Department of Health, basically, we've kind of given you some highlights of what they had to say. And the spread of the Delta variant has dramatically accelerated since Governor DeWine last spoke 10 days ago. We are at the highest level of cases since last February, said Governor DeWine. Only 35% of 12 to 17-year-olds across the state are vaccinated. I do want to say to our parents that we are going to have an optional survey coming out for those parents that would like to participate and allow us to know if their child is vaccinated, obviously the 12-year-old and up. The main reason for that is it's going to be kept very confidential, but if we have to do contact tracing, if we have proof of that vaccination card, they go right back to class. If they do not, they may have to go home until we have that proof. There was a concern per that meeting for those who cannot be vaccinated under 12 years old. The Delta variant plus no state mask mandate was a whole different ballgame, is what Governor DeWine stated. And they did urge mask mandates for the next few weeks, as they stated there was a surge in the Delta variant. Looking at our plan as of August 10th, we strongly encourage masking. We kept parental choice. I can tell you that everybody in this room, we all want our kids to be safe. We all want our kids to be educated, and everybody online. And we're tired of this virus. We wish we weren't here. We're here, and we have to make decisions for our kids that sometimes we don't want to make, but we have to make it as a community and make sure we're taking care of our kids. And when I say take care of our kids, yes, safety, but also educationally, and there has to be a balance. So what we talked about last board meeting was to consider changes as needed. We could look at classrooms, we could look at buildings, grade levels, district-wide level, and kind of look at what do we need to do per our data. We also, after that meeting, I created a superintendent's medical advisory board, which I will review. We met today at 3 o'clock, reviewed some of the data, not only our internal data, but also the data outside of Loveland City Schools. We are going to monitor internal data and county data and just make sure we're making good decisions based on what is happening nationally as well as statewide and locally. What I would like to show next, the internal data on masking. What we asked our buildings to do was to kind of keep track of what percent of our students were masking. When we said strongly recommend, we wanted to see what does that mean? How is our community going to respond? And I have to tell you, the community responded in a great way. When I look at the percents on here, and understand this is a snapshot of time during the day. This is not empirical. It's just us taking a look. How are we doing? Maybe in the afternoon, the percents go down. You don't know because this is a snapshot, but it gave us a good idea of where we are. And what it tells me is our community, with the high percentages that we have, they are worried about our students that are not vaccinated. They're worried about our pre-K through 6 kids. I want to commend everybody, all of our parents, our students, our buildings for the high percentages. As you can see, they kind of go down as you go through the week, because the issue with the teachers is if they're not required, some of the students coming in may not have put them back because they're hot on the playground and so forth. But to me, I want to say thank you to the parents for the strongly recommended and listening. And it also gives me a snapshot that we are concerned about those students. When I look at 7th grade through 12th grade, the percentages are much, much lower, okay? But again, I want to tell you what that tells me about our community is the pre-K through 6, the unvaccinated students, our community is concerned about. I'll get into it a little bit later, but the 7th grade through 12th grade, I worry about. I will tell you personally, I have a daughter who's a senior in high school. It upsets me that she lost her junior prom. She lost her extracurriculars last year. She lost a lot of what school is because of this virus, and we all dislike this virus. So we're trying to do the best we can. I think we have some good views of it from our medical advisory board and some good news coming up soon, but we just got to get through this. And so when I look at 7th through 12th grade, what I would say is our community is saying the vaccinations should work. When I look at, I'll give you one anecdotal example. Today, we had our first positive case of a student, and it came in from outside the community. It was not generated in the school. When we did the contact tracing, there were no close contacts. And that is because the quarantine guidelines of 3 feet have made it to where our mitigation and all the efforts our buildings are doing worked, okay? And that example, it worked. So when I look at the secondary 7 through 12, I worry about them getting vaccinated. And again, that's a family choice, but we are going to have a vaccination clinic set up September 2nd at the middle school, September 3rd at the high school. We'll get more information out about that. It's going to be during the day. It's going to be free of charge for our families. And if families want to access it, they can, okay? So that gives you a snapshot of where we are. And the dashboard that we said we were going to provide, we will update this on our website on Mondays. You're getting an early snapshot, and this is just after Thursday. Okay, so it's only 2 days, but I just want you to get a feel for what we're looking at. And if you look at it, got this in the way here. Okay, if you look at it, we had 0 students positive, 0 close contact. Again, this is just Wednesday and Thursday. Staff positive, we had 1 at the LECC, and that was outside. It did not generate any close contacts. And then at the high school, there was 1 generated outside, so it did not generate any close contacts either. The big number that you see there is the community cases. There are 24 community cases, which means there's 24 that we're looking at that were generated outside of the schools. And I know that everybody thinks schools can do a much, much better job with mitigating, and we can. I believe we can. But as the community goes, so go we, right? We will see if the community numbers continue to grow, we will see the same thing in our schools, but we will continue to mitigate as much as possible. Next slide, the county data that I would like to show you is as of Friday, that's August 20th, so that's today. The conclusion, when you look at that, COVID is on the rise in our community, and that can impact our schools. It's just what I said. When you have community spread, you'll work real hard to keep it out of the schools, but that's difficult, and we need to make sure that we're doing everything as we look at it. But as you can tell, you do have an increase. It's up on the increase there. If you look kind of a little exponential curve, it's moving up, and we're looking up through August 12th. So is that a concern? I have to say, yes, it is. It's on the rise, and so that is a concern. So looking at the Superintendent's Medical Advisory Board, I kind of want to go through the members that we have there. We have Dr. Paul Spearman, who's with infectious diseases in Cincinnati Children's, Dr. Virginia Miraldi Utz, Cincinnati Children's as well, Dr. Brian M. Grawe, who is our UC Academic Health Center physician. He's up at the football field right now, and we are excited for our Tigers football game tonight against the A's. Dr. Eric Swetchenow from Tri-Health, and he is also a board member here. Judy Leamy, who is our district nurse, who deals with the COVID and the mitigation on a daily basis, and our district leadership team. We are on the medical advisory board. We met at 3 o'clock this afternoon. We will meet every Friday at 3 o'clock so that we can discuss trends. What I would like to say is we are Loveland, and we want to look at where we are as a community and as a school district. So we take the medical advisory board, we take their knowledge. I said last board meeting, I'm not a doctor, I'm an educator. I need kids in the classroom. I need kids in school, and I need them safe, and I need to listen to experts, and I need to figure out how it's going to fit with Loveland along with our Board of Education. And so after that, I just want to get through it. The Medical Advisory Board, like I said, we met today, Friday, August 20th. A surge is certainly happening with the Delta variant. There's no question when you talk to individuals, the one individual who I would consider pretty close to what's happening is Dr. Spearman, who is with Children's as well as the other physicians. that are there, and there is a surge that is happening with the Delta variant. And so that is a concern. Unvaccinated suffering the worst consequences. I had a meeting, it was with local superintendents, Dr. Feggins from Mercy Health, who's also involved with infectious control, said that 98% of the individuals in the hospital are unvaccinated, that are in the hospital due to Delta and COVID are unvaccinated. Also coming out of the meeting this afternoon, hospitalizations of very ill ICU patients at UC Hospital at the same level as the peak last year. All of those are unvaccinated. That is what we heard from the physician. All of those are unvaccinated. UC is no longer accepting patient transfers, and that was from Dr. Graway, who is with UC. He gave us that information this afternoon, and that is a concern when the hospitals are no longer accepting patient transfers. Hospitalizations at Children's Hospital is at the same level as peak last year. So when you look at what are we concerned about, it is the level and where we are with our kids and especially the unvaccinated. So the last point there is the vaccine approval for younger students is possible later this year. When I said there's some encouraging news, that is the encouraging news. When you look at how do we move forward from COVID? How do we move forward so our kids can be unmasked and we can feel safe and we can do what we need to do? The vaccine is a big part of that. The statement I heard this afternoon was the Pfizer vaccine towards the end of September, beginning of October, we might be pretty close. Okay, so if we can all hold on as a community, make sure we're taking care of our kids, this may not be much longer. And I know we've heard that before, but I'm very, very concerned, and we have to make sure that we're looking at the data that we're getting from our doctors.
Mike, could I just ask you a question
I'm sorry?
before you? Mike, can I ask you a question?
Yes.
Mike,
Yes.
Mike,
sir.
can I ask you a question before
Sure.
you move off of this slide?
Uh-huh.
I just want to make sure I understand. No, let it go. Are you saying, Mike, that the hospitalizations, when you say same level as the peak of last year, that's the peak all year long, we're at that same level right now?
So the largest peak, and Dr. Swetchenow can jump in, but the largest peak, wherever that may be, I think it might have been February, that's where we are right now, is the comment that they made.
Thank you.
Children's.
So Kevin, I'll give you my take of the conversation that we had today with physicians at Children's Hospital. And I wrote this down just so that I remember the exact numbers that he said. And I understand that emotions are very high, and I understand that people want to give their feedback. Please let us try to get through this. I will try to bring every fact forward that I possibly can, but I can't do it if people are yelling at me while I'm talking. So this was from the physician at Children's Hospital today during our meeting. Hospitalizations nationwide are at a high point. There are 94,000 cases, pediatric cases reported over the past week. There are 1,900 children admitted in the hospital nationwide, which is a record high. In Ohio, there's 1,300 people hospitalized total, and 20 of those are pediatric cases. 9 of those pediatric cases are currently inpatients at Children's Hospital. This is not necessarily a completely accurate representation, as the 20 cases data may be a week or two out of date. So that, I hope that answers the question about hospitalization.
So specifically, Eric, did I hear you say, I should be okay now, right? Am I okay? Yeah, just to clarify, just make sure I'm hearing it right, Eric. Did I hear you say 9 at Children's?
Admitted with COVID currently.
Admitted with COVID currently. And to be at Children's, I know there are some exceptions. Once you're a children's patient, you get to be a children's patient for a long time, but generally speaking, that would be what age cutoff?
Generally speaking, it's 18.
Okay, thank you.
Okay, moving on to the next slide. The pediatric hospitalizations are at an all-time high and are rising. Hospitalization rates much lower than adults, granted, but rising numbers are concerning. This is data from Cincinnati Children's. And so I present that. Obviously, as you look, the growth is going upward. For August, gang, I'm just going to get through the presentation and make sure we're taking care of it. The August 2021 update conclusions. The COVID cases and hospitalizations are rising for kids nationally and in Ohio. Hospitalizations remain much lower, like we just said, than adults, but are at their highest level ever nationally and are rising nationally. All ages are affected. Delta is a highly transmissible and can be spread by vaccinated individuals. Universal masking in indoor public settings is recommended. So as you go through that, that is from the Cincinnati Children's as well. The next slide, what I would like to say is when we hear about masking, and I had some conversations with people today that are in this room, and I think we think masking maybe is the same as what we had last year. And last year was a different story because we really didn't know as much. But if the decision is to mask any student, any level of student, our staff is going to mask universally pre-K through 12. Students will be allowed to be unmasked in outdoor situations. So for example, if a second grade classroom, it seems like it's a nice day out, they've got read aloud, it would be a great idea. The teacher can take the students outside, we can unmask, and we can just do what we do without the masking. 3, the staff will be permitted to unmask if 6 feet from any student and if they deem it necessary for instruction. I can tell you that is going against some advice, but I do believe we need to worry about education and social emotional, and we do need to worry about that. For the 4th one there, in certain situations, staff and student may unmask if instruction is difficult to deliver. The example I put in here is your speech and hearing interventions. It's very difficult for those children when the teacher is in a mask and the student is. And so we want to be able to be flexible. I know I have worked with our building administrators enough to know that they want to listen to our parents and they want to take care of kids. And we know more this year than we did last year. So we can do some accommodating of students and make sure we do as much as we possibly can. If we have plexiglass in between teacher and student, and they're 3 feet apart, we can continue.
Mike, I'm sorry. Mike, excuse me.
Excuse me, if you want to come and
Excuse
do this to disrupt the
Excuse me,
meeting,
if you
it really
cannot
doesn't help
respect
anybody.
The report. If you cannot, excuse
Okay,
me,
you need to leave the meeting.
if you cannot respect the reporting, then you will need to leave the room.
You will be removed if you don't stop yelling out. You will be removed if you don't stop yelling out. This is the final warning. You will be removed.
Can we pause the meeting? Can we pause the meeting?
So what I would like to
Mike,
do is get
Mike,
through. I
Mike.
know
Mike.
this is emotional. I would like to get
Mike.
through the
Mike.
presentation.
Mr. Broadwater,
Mike, can
Mr.
I,
Broadwater, we'd like to pause the meeting for a minute.
We are
We'd
not
like to
going to
pause the
sit
meeting
here
for a minute.
and tolerate disrespect. Everybody needs to be respectful and listen to what the professionals have said. You are not up here on the board.
Kathy,
This is not an open discussion. Thank you.
Michelle, Eileen, Kathy, you may have been doing this already, but can we just suspend the meeting for a few minutes?
I did ask if we could pause the meeting.
So
for a
we're in
minute.
agreement, we're going to suspend for a
We're
few
going to
minutes?
suspend the meeting for 5 minutes.
Yeah. I didn't mean to.
So a couple more minutes.
Hi there.
Call us back in order. I would like to simply state, I understand, we all understand the feelings on all sides of this issue. We've received over 500 emails, messages of information. This is a meeting of the Board of Education. It has to be held in public, but it is not a public meeting. And so we have heard from the public. We believe that we have done our due diligence. I have personally tried to respond to every email that was received, letting people know that their information has been received, that their input has been heard. The purpose of this meeting this evening is for this board to hear a report from our superintendent about what is happening in our schools and to consider all of the input that we have received and make a decision as to whether there will be action tonight or not. We cannot accomplish that work if we are not respected by those who are in the audience. And if we are not respected by those who are in the audience, sorry, you heard that, but Zoom did not. I'm not going to repeat that whole speech, but if we cannot conduct our meeting, then we will have to go ahead and conduct our meeting up here amongst the 7 of us. And you will not be able to hear the discussion on the part of the board. You will not be able to hear any action that the board decides to take. Currently on our agenda is the hearing of this report. Once that report is over, there will be opportunity for board discussion, board questions, and you will hear the dialogue that goes on concerning what happens from this time forward. We cannot do that work if we cannot hear each other do that work. I really do appreciate all of the respect that we have received so far. And I do maintain that if I cannot hear, if board members cannot hear, and people insist on shouting, they will have to be asked to leave the meeting or stop shouting. I really do appreciate all of the sentiment. This is, as you very well know, not an easy issue to deal with. And we are all, I assure you, trying to do our best for our students in Loveland schools. I would like to ask Mr. Broadwater to continue his report. The board will have opportunities to ask different questions concerning his report and get other information as soon as he has finished his report.
Kathy,
Thank you.
just very briefly before Mike takes over, for the Zoom participants, Kathy's core message was something around 500 emails have been received by the board. All of them have been received. All of them have been read. We were well aware of what the community perspectives are on these very difficult issues.
Thank you. We had stopped with number 4, and the whole idea behind this slide was to let our parents know we understand it's a difficult time for our kids, and we are trying to do the best we can with a very difficult situation. And I would echo everything that is said. I have read every email. There have been many, many emails, and this is not easy. And I hope everybody understands at the end of the day, we think about kids first, and that's where we are. But for number 5 there, I want our families to know that a medical facial covering waiver will be honored based on medical verification from a medical healthcare provider. So that is an option that is available if there is a true medical need for the facial covering to not be present. And so with that, it doesn't want to move. And it is the last slide. Okay, so to get into my recommendation, the current policy does not allow for changes without a board meeting like this evening. I would recommend allowing the superintendent to have the ability to change facial coverings, masking rules based on current data. And what I mean by that is we want to look every single week, every Friday, if not sooner, and look at the data and see what we can do for our kids educationally and make sure we're doing it based on Loveland data. Currently, I would recommend a mask requirement for pre-K through 6 because they're not eligible for vaccination, and the unvaccinated are the majority of those suffering major health consequences due to COVID. For grades 7 through 12, I believe parent choice would remain strong recommendation for mask wearing simply because the vaccination option is there. And we have proven that vaccination is very strong in keeping people out of the hospital. Masking will be reviewed every Friday with the medical advisory board, determine if changes are warranted. Believe me when I tell you, I don't like seeing our kids in masks, but I also don't like having the responsibility of not doing everything we can for our unvaccinated students when there's a surge. And so if I hear that there's not a surge, then goodness gracious, it'd be great to be able to move to where our kids are safe, but we have to listen to our medical advisory board and do the best we can for our kids. So with that ends my report, and I turn it over to Dr. Lorenz.
Thank you, Mr. Broadwater.
Thank you.
I would ask at this point if there are board member questions about Mr. Broadwater's report.
Mike, one maybe just to get us started on this. Your view is the younger grades put a mask mandate in place for the younger grades and monitor it closely. So I think you said in here every week review that decision and tell me what your thinking is underneath that. Well, I mean, based on what you heard earlier today from the med professors.
Listening to the medical advisory board, and I will tell you, the medical advisory board probably not agree with what we have here. You know, we're trying to make it pertain to level, and what I would say to that, Mr. Doherty, is I do not take this lightly. I have children my own. This is not easy. So when we look every Friday, please understand that I understand education is better. I understand social emotional is better without masks. We're almost there. But I want to look at the data on Friday, and if I feel comfortable, if the medical advisory board feels comfortable, my leadership team, if we see the surge is going down and the Delta variant, like we have seen in other countries, starts to kind of fizzle out and go, then we need to be able to revisit and be able to change and adapt to what the data is telling us.
Mr. Broadwater, you are not unmuted for Zoom.
I
Maybe you could just
apologize.
give a quick recap of that for
Okay.
Zoom.
I apologize. The biggest thing is Friday, looking at our data, we want to make it Loveland data. We look at the Hamilton County, the zip code area. Right now, Loveland is on the higher end. We're not in the middle. We're not at the lower. We're a little bit at the higher end. So we'll look at our community, our zip code. We'll look at state. We'll listen to our medical advisory board. At the end of the day, I'll be out in the buildings looking and seeing how it's going. But we want to look at it every week. And I think even the September 13th date is a good date to kind of look at and say, where are we, where in every week, but kind of what's happening in our schools. And the other thing I will say is the data from our secondary buildings will tell us a lot too.
So I have to admit, when Children's first made their well-publicized recommendation, there was a part of me that wasn't appreciative of it because I didn't think that they made the case for it. But that's not to say I don't have respect for Children's. I and I'm sure many other parents in this room have spent too many hours down at Children's over the years for one thing or another. And for me, it was both here and Children's of Chicago. I spent way too many hours, nights, days in these hospitals to not have, I don't know, a deep respect for the competency of these doctors. So you've had some time, Eric's had some time to talk to them and to understand their thought process on this. And I think that's really what's missing in a lot of the discussion. How do they come to this conclusion? What drives this conclusion? You know, can you help put more texture on this for us?
Well, I think to me, it was important to have somebody from Children's. We actually have two physicians because I believe that's where you're going to see the pediatric issues, obviously, and that's my concern. Predominantly the unvaccinated, but also our other kids. The piece to the puzzle that I push Hamilton County Public Health on, and today Eric had some questions, is we really would like to have better data for our pediatrics. We see general, but it would be great if we could break it down. When you see adults, you'll see it by age group. And so we pushed on that for, can we see what that data looks like? So next week when we meet, what does that look like? And to your point, when it comes from Cincinnati Children's, there are people that come to that organization from all over the world because of their expertise. So we have to listen to a point, obviously, because they are the experts. But again, we want to see how it fits our community because every community is different. But I don't know if you have anything else to add to that.
Eric, are you going to add something?
I was actually making sure that I was unmuted on Zoom. I would say that it's very clear. Well, I could talk for hours about this subject, unfortunately, and I wish I didn't have to, but that's the position that I'm in, and I'm okay with that. It's very easy as a doctor to say the safest decision is to do this. The data that we have based on what's happened in the past is this, and thus this is what we should do. It's much more difficult as a school board member to say, that safety is my only overriding decision. And if I define safety as the number of cases or the number of quarantines versus the number of people who get ill versus the number of people who feel that masking is unhealthy for them or their child, it gets to be a much more difficult conversation very quickly. And I start to get too philosophical with myself when I do that. It's very easy to say that I can relay that the children's hospital physicians feel strongly that masking children in the current situation in which we have high community spread is the smartest choice for decreasing the number of cases and for decreasing the number of children who will get ill and potentially be hospitalized. That's the children's hospital position. I'm not sure that I have the same feelings that they have, and I'm happy to talk about those more, but that answers the question.
So before you get there, I'm just, for the moment, I'm trying to understand, people that are really well-trained, really well-qualified, how they come to this conclusion. And, it hits me that we know medical doctors when we talk to medical doctors. We know psychologists and psychiatrists when we talk to them. Again, spent way too much time in all of these offices over the years. But my sense has been that they're not of a limited scope when they assess a problem like this. If we think about psychological, emotional development of our kids, and a medical doctor may not be the perfect doctor to weigh in on that, but they do have exposure to this. And children's as a whole, I'm sure has exposure to this. So I guess what I'm trying to get to here, long-winded way, is how have they assessed kind of the balancing issue that many folks in this room or in our emails or wherever it's been out on the street have expressed about the potential detrimental impacts of masks. How have the professionals thought about that? Can you bring some light to it for us?
I can answer that to some degree. And honestly, I would reflect it partially back to Eileen, as long as you don't mind being put on the spot,
No, go
because
ahead.
she's the professional in schools and she speaks to the professionals in schools that sees child behavior on a daily basis for 8 hours a day, which is far more than I see child behavior. Where medical experts have landed is we believe that children in schools is better and healthier than children remotely or children out of schools or children participating in schools virtually. And we believe that the best way for children to stay in schools is to recommend vaccination and for children to be masked in school. Some people will say vaccinated children, unvaccinated children. Other people will say all children. The guidance is not uniform by any stretch of the imagination. But again, I believe that our teachers, and Eileen is representative of that, see more regularly on a daily basis the behaviors of children in classes than the physicians do.
Yeah, and I'm happy to comment on that. I have obviously this is a hot topic and I've spoken to many of my peers about it. I've spoken to many Loveland teachers and I don't speak for all of them. I haven't spoken to every Loveland teacher, but I have yet to find a single teacher out there that says that masks are harmful to kids as far as their social development. So there are also reports out there that have studied it and have debunked the myth that the social and emotional aspects are greatly harmed. Obviously, that's not true for 100% of the kids. It's not true for 100% of the teachers. The majority of kids want to be in school. They are happy with their peers. I haven't seen personally, again, one teacher, one view, one classroom. I haven't seen negative effects of the mask. The kids want to wear them? Absolutely not. Do the teachers want to wear them? No. But as far as their development and their happiness,
And Eileen, I can chime in on my own.
sorry, I was pausing until people
Oh.
stopped being rude, but
I'm
go
sorry.
ahead.
Well, I can chime in on my own extremely limited experience,
Yep.
which is My children would personally prefer not to wear masks at school, but would be much happier wearing a mask to school than not going to school at all.
Absolutely.
That's not necessarily reflective of anybody else's experience but my own.
Mhm.
So I guess the question I was asking, probably at this point, the three of you, is the medical professional consideration of the potential mask wearing issues when they make a recommendation that we do universal masking. I'm just trying to bring to the surface, because I didn't get a chance to talk to these people live. I'm trying to bring to the surface how professionals that are way better educated than I am on this stuff think about the holistic viewpoint on this issue. And anything more that you can help, I would find, I'd be appreciative of.
I think, so if I can jump in real quick, obviously, I'm not the medical professional either. So, but just from talking to some of the doctors at Children's, because I do know the ones that joined today, they were talking to me about how the infection is higher, there's an increased transmission. They were talking about double time, which I had to ask for clarification on that and the rates that they're seeing it occur. And they also talked about the social emotional and how they're not seeing what is being reported in a lot of media sites or social media, if you will. So the comment that was made to me by Dr. Utz, I'm sure she won't mind me putting her name out there, and this kind of goes along with a question that I had for you, Mike. Looking at the numbers you provided for the middle school and high school, I'm really surprised the recommendation would be to mask only K through 6 and not everybody. And again, I'm going back to Dr. Utz said the unvaccinated in high school are going to pay dearly if they aren't masked. And I appreciated this quote too, that she said, this is a war. We're fighting Delta, not each other. So we need to wear masks to help one another. So
I'll come back to that in a minute, but if there's anything else from the medical professional side, again, I'd appreciate hearing it, because we just don't hear them talk about that.
Yeah, no, I agree. I think to your question, Eileen, I think the easier thing to do if you listen to the medical would be pre-K to 12 masking. And I don't want to say easier, but we are looking at exactly what you're talking about. We want our kids to be socially, emotionally, and we want them to be happy. I know as a parent of a student that's 12 years old or older, I've got a couple tools in my tool belt that I can use to protect my child. These younger kids, there's only one extra tool that we got left, and that's that mask. And so the social, emotional, I get. That's why the whole purpose of that masking slide was to show it. We understand that, and I hope people know this is just not easy. We don't want to be here talking about this. Our public health officials could have moved forward, but what I will say is, when you look at everything we put on that slide about the mask, we understand that, if you have a chance to go out and it's in the afternoon and you're going to do a read aloud, get the kids outside and do it that way. I also think, Kevin, what I'm hearing is for the medical advisory board, it would, and I think it's a great idea. It probably would be wise to have somebody who's there, who's a clinical psychologist, and let us know their thoughts when it comes to that, because that's a whole piece that is tied into these decisions. So yeah, that would be my perspective of it's important for kids to be kids. It is, but we need to have them in class.
So I'd have to be honest and say, I really haven't gotten the answer that I was hoping to get,
Sure.
but meaning that they had a specific feedback there, sorry.
somebody was
Volume
talking
on
out
that?
there.
Yeah. I mean, I'm left to surmise that they've issued what they consider to be a balanced recommendation. From their perspective, there may or may not be issues with wearing a mask, but they think if you will, the medical risk maybe that's not the right term, but the COVID risk in their estimation is more significant. That's what I'm left surmising, but be nice to hear them explain,
Kevin, I think you're struggling with that for the exact reason that you hear about it less. It's much harder to measure that than it is to say, look at these cases. And so you use cases as a proxy for illness. And I think rightfully parents are concerned about the parts of the story that aren't necessarily told. And it's hard to measure that. And that's why you don't hear it.
so if
And-
you, go ahead.
Sorry. I think that's a great idea. And Dr. Utz from Cincinnati Children said she'd be more than happy to recruit a psychologist to join the Friday medical review committee. So I'm sure that she'll be in touch with you, Mr. Broadwater, with the name of a children's psychologist.
So if you all will bear with me, I just have one other aspect at this juncture to kind of hit on. I apologize for taking as much time, but this is something I want to understand better. But I look at the curves, and I'm kind of into numbers, as you know, and I look at them, and I see two different things. One is that I see a little blip over here that says, well, it's a little blip, right? I mean, in comparison to where the country has been, this isn't a big thing at the moment. But I also realize that small things can become big things in this environment very quickly. So trying to look at this really from the lens that I looked at the overall issue of safety in the workplace for many years. And, I had a job that caused me to deal with fatalities every single year and deal with untold hundreds and probably thousands of employee issues. So it's a very real thing to me. This idea of safety is a very real thing to me. And one of the things that I learned over a lot of years dealing with this is that it's always hard to kind of justify your decision to do this or that, because you're always thinking about the probability of something happening in the future. It's not so often. I mean, it's a bad situation when you're kind of reacting to something that happened today. Somebody got sick or somebody got killed, or God forbid. That's very motivating at the moment, but on a day-to-day basis, you're trying to prevent things from happening. And that's what I'm trying to weigh in this conversation, because one could argue that the data doesn't portray a big problem at the moment. The problem is that there is the risk, and in this case, maybe a very significant risk, that can turn on a relative dime. And the thing you don't want to be doing is taking corrective actions after the fact. When it comes to safety, you do things before the fact. I'm just trying to understand, is this exactly the right time, or is some other time more appropriate? And maybe you guys have a feeling on that issue. Those of you that have been in the medical discussions.
I mean, I think just from looking at the surrounding school districts, the number of quarantines, I can't speak to the number of actual positive cases, but the number of sporting events and activities and kids quarantined from school is pretty telling. And I mean, let's not kid ourselves. Everybody saw the picture of the hallways at the high school. I mean, I'm sure everybody in this room saw it, with 2 and 3 kids wearing masks. We're going to be in the same situation as these other districts. And as Mike has said over and over, our job is to educate kids. And if we can't keep them in school, we can't educate them.
Well, Eileen, I think that's that I'm glad you said that, because that's a perfect pivot point for me. And I've thought about this very hard over the past several weeks. And there's a couple of things that I think are important for us to decide as far as this particular decision. Is there any way that I can share my screen? Where's our tech help?
Over there.
Or do I need to be Mike to share a screen? Oh, thanks, I appreciate it.
Cullen's coming up to do that
Okay,
for you.
that's great. Kevin and I agree with your point. There's a fine line between not being proactive in order to prevent death and illness and being fearful of what might happen in the future. And I have a hard time, thanks, this is just a website. I have a hard time supporting decisions made out of fear of what could happen than what is actually happening. And I understand that people disagree with me on that, and I accept that. Some people would say, well, you can't wait until we're in a situation in which our hospital capacity is full, until you make the decision like Texas has done, or Alabama, or name your state here. Is this being shared now? So this is a picture from the Greater Cincinnati COVID Situational Awareness website, which is a group of hospitals and data that's being shared as far as rates. And one of the things that I need to very clearly say is that in the summer, we had summer school with children in class without masking, and we had no problem at all with COVID transmission in those classes. And if you backdate to the bottom left of these screens, you can see that our overall rate of transmission at that point in time was significantly lower in our 14 county area of Southwest Ohio. I bring this up only to say that our situation right now is not the same as our situation a month ago. And our situation in a month is not going to be the same as our situation right now. I have no idea what these curves will look like in a month. How do I decide what to do to make sure they don't continue to rise rapidly to the upper right? I have a couple other things that were important for me to share. And this one's from the Ohio Hospital Association. And this data is specifically for Southwest Ohio for the week of August 9th to August 15th. So remember, I'm working off of data that's now 1 to 2 weeks old. I don't know how tiny that is for everybody, but you can see in the bottom right again that the curve is going up. But if you look specifically at age 0 to 17, which is the group of people that we're talking about right now, it makes it look as if there's nobody admitted in Southwest Ohio. I know today from talking to the Children's Hospital physicians that's not true, but there certainly is not a dramatic upsurge of children in hospitals that are about to overwhelm our system. I got to figure out how to make this smaller. I have a couple other things that are out of order, and I apologize. I would have been much better prepared, except I returned home at 5:15 today. This graph, which also is small, is taken from Ohio COVID-19 data from the state, and it's graphed in a way to show your total inpatient beds, your ICU beds, and your ventilator capacity. The circle at the bottom is a number of COVID patients that are currently admitted. And you can see that our total bed capacity is pushing 80%. Our ICU bed capacity is the same. But right now, at least, the number of COVID patients, this is not pediatric, this is overall, is low.
What
If you
was
look
the
at,
scale on that?
sorry, let me go back, Kevin.
Where did that start and end?
The date was August 4th to August 17th. Same data, coronavirusohio.gov. This is from an organization called Real Data Trends. Ohio patients currently with COVID, daily counts, hospitalized ICU ventilators. Where hospital systems get concerned and where I personally get concerned is watching logarithmic curves at their bottom. And you can see that this includes November and December, when quite frankly, what people believe or not, our hospital systems were stretched very thin. It was within a short period of time of becoming overwhelming for our hospital systems. That didn't happen. That logarithmic curve flattened out and went back down. It still was stressful and challenging, but it didn't overwhelm hospital systems at that point in time. We're now, in the past 2 weeks, at the bottom of a logarithmic curve, and we don't know where it's going to end. Going back to what I was saying, the hospital bed counts of patients with COVID peaked at around 20% back in mid-December. We're now at 6%. Again, if you look at the curve, it's hard to know exactly where we'll be in a month, I can tell you, and again, what you choose to believe or not, 20% of hospital capacity for COVID is dangerously close to overwhelming hospitals in the Cincinnati area without shutting down other healthcare. So you can always stretch more capacity by stopping other things, but without stopping other things, you don't have the ability. And lots of things, as everybody knows, aren't able to be stopped. Heart attacks can't be stopped, strokes can't be stopped, car accidents can't be stopped. This data I put in specifically for Kevin to remind us of Kevin Hawley's data that he used to show us. Nobody could possibly read this, but what it shows is the active number of Ohio populations in the far right-hand side. And again, I'll ask that all of this gets attached to the agenda so people can look back at this. On July 21st, the active number of Ohio population actively infected with COVID was 0.08%. It's gone up to 0.40%. So you could say that's a tiny percentage of people in the state of Ohio, or you could say that's a 5 times increase over where we were a month ago. And another 5 times increase from there is going to be very challenging for us. This is reflective of that exact same data in a way that's a little bit more legible and not quite the same because the dates weren't the same. But at our peak, 1.45% of our population was actively infected. And right now we're around 0.4. We've gone up 5 times in the past month. I'm not saying that we'll go up 5 times in the next month. I'm saying we don't know what's going to happen. I like this picture because it puts things into perspective. The number of people who have recovered from COVID is much, much higher than the number of people who have active cases or have died of COVID. It's just a perspective sharing graph of the total number of people infected since the beginning of this pandemic. And this is just a reflection of all of that information. 0.40% of people are actively infected right now. Currently hospitalized patients in all of Ohio is 6.4%. Remember, 20% is our break point. I've talked much longer than I typically talk. I'm good at sharing. We can stop screen sharing for me. I use all of that to say that I personally have come up with 3 points that I think it's important to be more aggressive with restrictions than we're being. One of those is hospital capacity. If hospital capacity is a problem, it's a problem for our whole city. Thanks, I appreciate it. If our hospital capacity is in danger of being overwhelmed, I am firmly in favor of increased mandates to restrict the nature of this disease and the spread of disease. Another one is if we demonstrate that unmasked children in classrooms are passing COVID to masked children in classrooms, I can't tolerate that. I understand that everybody gets to make their own decisions about their own risk levels, but I don't think it's okay for, and I'll just use myself as an example, I don't think it's okay for my child that I sent to school masked to be infected by Michelle's child who didn't get sent to school masked. So that's another break point for me. There's a quote that's attributed to Oliver Wendell Holmes, one of our one of our Supreme Court justices in the late 1800s, I believe. And his quote, or at least is attributed to him, was, "Your freedom to swing your fist stops where it connects with somebody else's nose." And that's quite frankly my break point. If we show that unmasked children are infecting masked children in classrooms, children need to be masked. The third one, and this goes back to Mike's biggest concern, is if we are unable to keep schools running due to absenteeism and quarantines. Quite honestly, I have fewer concerns about cases and quarantines than most. Our quarantine rules right now heavily favor vaccination and they heavily favor masking. If you're being quarantined from school, you've chosen to go to school in full realization that COVID is present, you could be infected, and if you're close to somebody who's infected, you'll be asked to quarantine. So for my purposes, those are the 3 pivot points that I think make me feel strongly that we need more aggressive rather than less aggressive restrictions in schools.
I'll ask again, are there other questions concerning Mr. Broadwater's report? And then I'll go into what possibilities the board could have for action this evening.
Just one thing It's not even a question, so. But Eric, you were talking about summer school and you said there weren't any problems, but the reason I don't think that's valid to use when looking at our current situation, my daughter went, Kevin and I went and toured. The first week, there were 12 kids in her class. Second week, there were 9 kids. And of those kids, at least half of them were masked. Now the kids are in classes with 28, 29, and in busy hallways, so.
Didn't they
And-
ride buses
and our-
without mask?
No, they wore masks on the buses.
I thought
And our-
summer school they didn't.
our-
Okay.
Our rate of disease in the community is significantly higher than it was a month ago.
Other questions or comments?
Okay, I just want to make sure I'm understanding. So what you were asking, if we do some kind of action that you're wanting to come Monday, mask staff K through 12, and then all the kids K through 6. That's what you're asking?
Wait, say it, I didn't hear you, Michelle.
I'll clarify for the board so you know where we are. We've had a report from Mr. Broadwater. And I believe that he has explained to us the information that he's using to make his recommendation. His recommendation is counter to our current policy. Our current face covering policy says that face coverings are the choice of parents or guardians. In order for Mr. Broadwater's recommendation, which is for all staff to be masked and for K through 6 to be masked and for 7 through 12 to have the choice of masking, is counter to that policy. So there are 3 actions that could be taken by the board this evening. Number 1, the board could choose to rescind the current policy so that it is not in effect, that there is choice for masks. The board could choose to enact a policy that gives authority to Mr. Broadwater. And there are a couple of examples attached in administrative content for the board to consider this evening. And then the third action that the board could take, even if they do make a change in the policy, is to pass a resolution agreeing with Mr. Broadwater's recommendation for this evening, so that there's no question of whether the board wants it to take effect or not. All those actions can or would have to be taken in order to make any change in the current situation in masking in the schools. Questions about those options?
Can you give a really quick, brief 1, 2, 3 again?
Okay, the board
I want
could
to write it down.
rescind the current policy, which restricts face coverings in schools to be totally parent choice. If you'll recall, we were asked by legislation, by Ohio law, to pass a face covering policy during the height of COVID a year or so ago. I forget how long ago it was. We passed a face covering policy that said that face coverings were mandated in school buildings. And you'll recall as board members that we kept wearing masks through June or through till the beginning of June because masks were mandated in buildings. We then in June passed the current policy, which was that masks would be parent choice. So in order for any masking to be required in buildings, we would need to rescind that policy. There are 2 choices on board docs in administrative content. We did not make those public because they were not policies that have been discussed by the board. So they're open for discussion tonight. One of them simply gives Mr. Broadwater the authority concerning masks. The second gives him authority, but sets certain restrictions on his authority and certain parameters as to how and when he can do what he does. And then again, the final choice, the board could also make a resolution tonight confirming that they are in agreement with Mr. Broadwater's current recommendation for this evening, just so that it's clear when the policy takes effect. So those are 3 three actions that could be taken, would need to be taken if there is any change in masking policy in Rutland schools.
Okay, so
What
you're saying,
So there's no option where it's masking K through 12, and if not, can I put forth a motion to add that into discussion and consideration for resolution?
There's no, the policies that would be rescinded and approved do not speak to K through 6, K through 12, whatever. They simply give the superintendent the authority. The resolution approving the K through 6 recommendation of Mr. Broadwater this evening could be made. There could be a resolution proposed from the board for something other than that, that would go against Mr. Broadwater's current recommendation.
So
And that
first,
would need to be a motion made by a board member, seconded by a board member, and then discussed.
we need to decide if we want to change the current policy, correct?
That would be my recommendation, that the board consider first the issue of rescinding the
Rescinding.
current policy. Oh, I'm sorry. First, the board needs to pass a resolution to amend the agenda to include any of these items. And I would suggest that when you're ready, we make a motion to amend the agenda to include the rescinding of a policy and the adoption of a revised policy. I haven't made that motion yet because I don't know the board is ready for that action. After that happens, there could be a motion from the floor to amend the agenda to add a resolution either supporting Mr. Broadwater's recommendation or proposing another recommendation, which wouldn't be his recommendation. It would be a board recommendation at that point.
So
Michelle, you're still looking at me with a query in your
Can we
eye.
just start with step one and then discuss the rest?
Pardon?
Can we just start with step one and then go to the next?
That's what I was suggesting.
We can, yeah, but
Yeah.
then you went on to 2, and I think that's when some
Well,
confusion
that's-
came in. So if we
Okay.
just talk about rescinding the current policy, then move to step 2. So we're not making a decision on no masks on K6 or K12. What
My
we're making a
suggestion-
decision on is taking that policy back, correct?
As soon as I see the question disappear from Michelle's eyes, I'll go ahead and make a motion, but I want to hear the question in her eyes first.
I feel like there's too many issues here. I think our policy should come last. I think we
have
need to
to
discuss
get
the
rid of
other.
the one we already have in place, Michelle.
And I don't think we can consider Mr. Broadwater's recommendation if we don't rescind the current policy, because the current policy says masks are voluntary.
Right, but aren't we trying to discuss other options?
After that,
If we discuss other options that include not having masks be voluntary, that's happening before, while we still have a policy that masks are voluntary.
So also, one other dimension of this is that you could end up with the adoption of one of these policies that in the real world wouldn't result in any different.
yeah, that's
activity
what I was
we're
gonna
doing right now.
say.
It is
That might be,
possible.
is that where your confusion is? If you are, it should stay parental choice. If we rescind, that's gone. Is that your question and confusion? Because
My suggestion would be rescinding the current policy because it is not nimble at all. There is no way to make any change if there is serious concern about our schools with quarantine, with cases, with anything. It cannot be changed. So my suggestion would be that we rescind the current policy and pass a policy that gives the superintendent authority. Then this board could make a resolution that says, sorry, superintendent, we've given you the authority, but right now we want it to stay mask optional. Or right now we agree with your recommendation K through 6. Or we want to make a recommendation K through 12. But we can't make any of those recommendations if we have the policy that says masks are totally optional.
I guess this is where I'm confused because we're discussing options to move forward, but we want to get rid of this. We may not want to get rid of this. Our policy as written, we may not want to get rid of it. So
But if-
why would we get rid of it?
Because right
it
now,
says
Mike
parent
can't,
Optional. It doesn't say optional for the buildings. It says parents have the
because if Mr.
choice.
Broadwater needs to make a change, we have to wait until we can all meet and give notice.
So
We cannot say that children K through 6 must mask in buildings.
I didn't know we were.
No,
I
it's
didn't
just,
say we
no.
are. We cannot at this point. We cannot mask anybody with a mandate with our current policy because it doesn't say
Right.
Mr. Broadwater has a choice. It doesn't say we have a choice. It says parents have the choice.
But we're discussing. We're discussing options.
Let-
So why are we getting rid of what's there if we're just discussing options at this time? Then as we vet through the options, if it's looking like we might want to do something else, then we would go back and get rid of that policy.
My reasoning for suggesting we get rid of the policy is if we do not change the policy this evening, we cannot mandate masks anywhere until we have another school board meeting.
I think what
and
I'm
And you all
hearing,
know how difficult it was to have.
Let me,
I think, thank you. I think what I'm hearing Michelle say is before we get into changing any of the policies, why don't we have a discussion about where we think this thing should be going? And then we can
I
change
think that's what
whatever.
I said. I said, we're not ready to make those resolutions yet. I was suggesting what the
So
possibilities
the
were.
first step, if I'm hearing you correctly now, the first step in the conversation is, do we think we need to change what we have right now to something else? And then we'll evolve into what the something else is.
Okay, because what I heard was we need to cancel that policy before we could discuss it. So that's why I was
Kathy
asking.
was saying from a procedural perspective, once we get there,
We cannot make a decision without rescinding that policy unless our decision is to leave the policy where it stands. We can certainly discuss, but we could not pass a resolution saying that Mr. Broadwater has the authority to do something if our policy stands the way it does, because he doesn't have that authority.
we'd be in
Kathy,
conflict. So we
Well,
have to
I know
move
that,
Wait,
forward.
but-
let me interject for a second. And so couldn't we, to get to Michelle's concern, couldn't we pass a policy that simultaneously rescinds our previous policy?
I don't think it matters. I think Michelle's question is, don't rescind the policy till you know that's what you want to do. And that requires discussion, and that's fine. I'm just saying you can't pass a resolution mandating masks K through 6
Unless
until
part
you
of
have
that
rescinded the
resolution,
current policy.
or unless part of that resolution is rescinding the current policy.
Yes.
So it doesn't have to be two separate things.
No, it's easier to.
We get the PA volume down just a touch because we're getting a lot of feedback. Thank you.
I'm with you.
So discussion.
So I think the policy that we have right now isn't flexible.
I don't think they can hear you out there.
Colin, did we go too far with the volume?
Yeah, there we go.
Is that
It's
better
getting a
now?
little better.
Can you hear me now? Can you hear me now?
Can you guys in the back here?
How about now? Can you hear me?
Okay.
There's a fine line with the feedback on that volume knob. So I'm sorry. I guess all I was saying is that the policy that we have right now is very restrictive. I think I'm agreeing with you on that one. It's very restrictive. If things were to change, one way or the other, frankly, it's slow to react to that. So I think an update to the policy from my perspective is in order. I think we need to have a lot more conversation about what the replacement policy is, but that's coming.
I agree with Kevin that the way that our policy reads does not give us the flexibility as a district to behave in the way and perform the way that we want to.
Michelle, that's not saying that you can't propose a parental choice option still. But at this point, if Mr. Broadwater were to need to change something immediately because something has happened suddenly, he doesn't have the ability to do that.
I'm not disagreeing with that necessarily. What I'm disagreeing is, I'm trying to have the discussion of what could be our options. But I feel it just keeps coming back to, let's cancel this policy. Let's cancel this policy. And I'm not saying we won't. I'm not saying we will. I'm not quite sure why we have to do that right away, until we discuss our different options.
Well, my understanding is that we don't have to, vote to rescind the current policy before we have a discussion about what we would potentially replace it
Okay.
with. I think, if I understand the conversation correctly, Kathy's suggesting that we just get on the same page about the procedural steps. If there is going to be a change in policy, we're going to have to remove the current one,
Right?
and then we're going to have to
I'm fine
replace it
with
with
that.
something different. I think that's all
But
we're saying. at this
okay,
juncture.
so we are going to open up the discussions now for
What we would change it potentially to.
Yes.
okay, so we're not canceling anything yet.
No, there would have to be a resolution to do
Okay,
that.
okay.
We're not voting on anything at this juncture, right?
Right.
Right.
We haven't even voted as to whether we're going to vote on anything. If you want to talk about policy.
No,
I
I
vote
want to go any
yes.
further on that one.
You can't vote yet. So discussion.
I have something that I'd like to read if that's okay, and it leads into where my opinion lies. And which I think I've made pretty clear now, but so around the country, we're seeing the real human impact of inaction and delay in taking all the precautionary measures available to schools to protect the children in their care. I know that in some of the emails we've received, it's what has changed in the last 2 weeks that you need to make a change now. So I would say in just a short time, several things have changed. The rate of spread, number of quarantines that we're seeing, large number all around us in the surrounding districts, the number of events being canceled, amongst other things. We'll not be able to continue in person if we experience mass quarantines like other schools have seen already. These schools have only been in session for a week max. The virus, we all know, is not something that cares about opinion and debate. We can't afford to continue to rely on luck and good fortune to keep our children and staff safe while the Delta variant spreads around us. I believe it's our responsibility to err on the side of caution when it comes to the very lives and education of the children in our care. Anti-mask politicization, I can't say it right, is based upon a fundamentally flawed idea of freedom. As citizens, we have seatbelt. As citizens, we have seatbelt and child seat laws, speed limits, and bans on smoking in workplaces and restaurants, to name just a few public health and safety regulations. Before COVID-19 became politicized, we collectively seem to understand and accept the importance of public health and safety, even if and when it required some degree of personal sacrifice. With all of our supported counties now being rated in a higher risk category for transmission of the virus, now is not the time to choose to disregard medical guidance and recommended best practices for mitigation. I believe that we have a great medical team and that we need to follow what they have advised. If we do, then I fear, like I said, that we are not going to be able to keep kids in school to educate them. I think that it's imperative for the school board to adopt a K-12 mask requirement at this point in time. Excuse me. To keep kids attending school in person 5 days a week without having to go back to what happened last year. So therefore, as the leading professional and medical voices around us urge universal mask wearing to combat the spread and protect children in our schools, to allow us to continue in-person instruction, I strongly urge my fellow board members to immediately implement a policy of mandatory mask wearing indoors for all grades and buildings K-12. No solution is going to be perfect, but we're weighing risk and making an informed decision. So the time for action is now. And then what I'd say in regard to Eric's comment earlier, I don't remember if it was when we were talking out there or you said it out here. You were talking about K6 because they can't be vaccinated. I'm advocating for K-12 because, like I've already brought up, I saw the pictures in the hallway and I know that the hallway directions have been corrected, but that doesn't mean that kids aren't going to gather in groups. And I understand some are vaccinated, but when you look at the numbers, the percentages of kids wearing masks, when you look at the percentages of kids in that age range that are vaccinated, it isn't high enough to prevent the spread. It isn't high enough to have herd immunity. I love my child, my high schooler, but he is probably the smartest, dumbest kid I know, because I can tell him as a parent, you're wearing a mask, wear your mask. He comes home from school and I asked him, did you wear your mask? Oh yeah. I'm going to bet money that that mask came off as soon as he got to school. So it shouldn't be a kid's choice. Their brain isn't developed. I would love to pretend that he's going to listen and do it. And I think that a lot of parents out here, a lot of parents watching are thinking and saying the same thing. My kid's not going to keep the mask on if there are only 2 kids in the high school in that hallway wearing a mask. So I just think it is the way to keep kids in school when our job is to keep them here to educate them.
Other discussion?
Eileen, just for clarity, you've expressed an opinion. You're not asking us to take a vote on that at this point in time, right? So we can continue to
Correct.
discuss
I just want,
everything here for a
yes.
while.
Yeah, I
right?
thought that we were discussing everything, putting on the table, but I ask you to please keep all of that in mind.
Well, I would like to add, if it's okay, in response to Eileen's concern about that. You're absolutely right. You know, at what level in time do we say this is the parent's choice, and when does that parent's choice become the 12-year-old's choice once they got to school? The teachers can't police whose mom told them they had to wear a mask all day and whose mom didn't. That's an impossible task. So there is value to the concern that even if I say I'm very much for a family's right to decide this, ultimately I'm putting it in the hands of a 12-year-old.
Other discussion?
I'd like to say that we all have, as a community, we all have one common goal. And it's the same common goal, and it's to keep our kids happy, healthy, and safe. Unfortunately, we're divided, whatever percentage it is, but we are strongly divided. But it doesn't make one side wrong and the other side right. Everybody has their own beliefs, their own opinions, and they're all valid, every single one of them. I'm not sure how as a community we work together to achieve this one common goal, because it can't be all one or the other. We've got to find a way to work as a community to come together. It just, I mean, it's so divisive. It's explosive. It's not good for our kids. We need to do something. And like I said, our common goal is to make our kids happy, healthy, and safe. I don't think there's one person that would disagree with that. And now we have the job or the task with hopefully help with the community. How do we do this? How do we work together and make this happen? And I don't know the answer. I've been racking my brain. Does it look like we all come into school and mask for 10 days as we acclimate to our new surroundings, and then we unmask in class after that? And we mask where there's new people. I don't know what it looks like. Like I said, we all have opinions and they're all valid. And I think we all know.
I would like to just make a comment at this point. I agree with Michelle that we are divided. I would just like to comment that I do appreciate the way the audience has helped us facilitate our discussion, continue with our discussion. I did want to make one point about all of the emails that I've read. One interesting point was that both sides presumed that the board was hearing from the other side as the loudest voices. And I just want to assure you that the board was reading every email, was following almost every link. I can't guarantee that I followed every link, but
Close.
there was not a sense on the part of this board that we read the kinds of emails we agreed with, or we didn't read the kinds we didn't agree with. And so it was that the voices were heard on both sides of the issue. And with a couple of very few exceptions, I honestly don't believe either side was the loudest voice. Both sides made very clear, compelling arguments, gave examples and experiences that were very difficult to read, very heartrending to read. And so I simply want to say that so that this audience who is here and our audience on Zoom understands that we make decisions not based on any loud voices, not based on any one side versus the other, but make decisions for what we believe to be best for our children.
So I have more, as I usually do, to throw into this conversation, and I realize what time it is. But it's important, and I'm sorry. I'm going to say what I need to say here, but I was actually going to say this for closing, but based on Michelle's comment, I did write a thought down, and I will read this because I'll do it faster if I read it than if I do it extemporaneously. If you've worked with me, Eric has worked with me a lot over this last year, and there's a phrase that I use about the day after. Think about the day after. Whenever I find myself in a kind of a contentious situation, particularly difficult situations that push the way people think around. One of the things I say is think about the day after. How will it feel the day after? And in that context, I'll just ask everyone to think a bit down the road. This is really directed primarily at the community. As we work our way through this, I think sometimes it feels like, maybe it's only us up here on the board, but it feels like we forget that we're all neighbors. God knows we have different views on how this whole thing should be settled. God knows we're all over the place on this thing. But there will come a time somewhere down the road where this will be behind us. And guess what? We're still going to be neighbors that day. And how we're able to live with each other will be in part influenced by how we behave, how we talk to each other, respect, listen to each other right now. Not a new message, but I think it's an important one. As passionate as everybody is, and God knows you're passionate. God knows that. I mean, these emails. Forgive me for using this characterization because they're not all like this, but it feels like you're being shouted at, and these aren't like 2-sentence emails. These are, and people are being extremely vocal, extremely opinionated, and sometimes, well, I'll just say they're very strongly worded, and it's not easy to sit there, read all of this and listen to it, but that's okay. We get paid a lot of money to sit up here. So, yeah, right. So we do hear it, and you have a right to say it. I'm not saying that you don't have a right to say it, but at the end of the day, it's clear that there is no answer that's going to make everybody in this room and the thousands of other people in this community happy. There's just no answer that's going to do that. So what I hope when we finally end this discussion somewhere down the road, we'll at least have an appreciation for how everybody's thoughts, opinions, fears, concerns have been considered in the process. And at the end of the day, I don't care, I guess, I don't care if people don't like me. That's not the point. The bigger point is how you are with each other and how we're able to eventually come back together again as a community when this thing is not the issue, the divisive issue that it is right now. So I've more to say as we get through more of the conversation.
I just want to reiterate, we are listening to everyone. Just because we might not be saying what you told us to say, or no one's told us to say anything. Let me rephrase that. Just because we're not saying what you told us your thoughts were, doesn't mean we didn't hear them and they're not considered. Please understand, we every word that is written to us, we are listening. And it just makes it that much harder for us. It's not a cop-out, but we are listening, I promise you.
How can you listen if we're not allowed to talk?
Kathy, just to clarify things, we did have something overall, I think, of 500 emails so far. And I want to think 300 of those have been in about the last week or so. Is that right?
I don't want to take too much time with it, but we have received emails from over 400 individuals, closer to 500 different opinions, discussions, suggestions, personal experiences. Many emails contain multiple links to news articles, research data, videos, and other sources of information that we have reviewed as well. As I mentioned before, I did try to answer each email individually. I think I broke my email today, and I think a few people got 2 or 3 responses because I was getting a little crazy there. The input we received prior to the August 10th meeting was split, as I reported then, almost exactly 50-50 between mask requirement versus mask choice. My tally was then 73 responses for mask choice and 70 for requiring masks. Since then, it's been harder to quantify the responses. After August 10th, when the current policy was left in place, we received mostly emails asking for a mask mandate. Once this meeting was announced, then we began to receive emails asking us to keep the current choice policy in place because people began to worry that because we set this meeting, that automatically meant there was going to be a change in policy. As we've stated here, the board can only act in a public meeting. Discussion is required to be held in open meetings. So that's what we're doing this evening. We've received over 100 emails since Mr. Broadwater's video. Thank you very much, Mr. Broadwater. Since Mr. Broadwater's video announcing this meeting this evening and asking people to respond to us. So that's why I say we've gotten, I would say 500 responses. Those are multiple from some families. And I do want to confirm that I know board members have spent many hours reading the emails and many more hours considering the data and information. As I mentioned, the situations related in those emails were emotionally draining as well. I do want to thank everybody who took the time to make their opinions known, to share information and to share experiences. I want to thank the audience that's here this evening, whether you feel that it is wrong that we do not have public input during a special meeting. Your voice is being heard with your signs, with your respect to us. We do understand that you are echoing the variety of voices that we heard in those 500 emails. So please do not leave here feeling that because we do not have public hearing here, we did not hear what you have had to say.
Kathy, just again, this is a lot of folks don't get involved with the nuances of how all this stuff runs. There are laws that are pretty specific about us prohibiting us from meeting in groups of 3 or more and talking about school business. So these meetings are the only time that we get to really be together and to talk through stuff like this.
That is correct. Any group of 3 board members who meet and discuss board business are acting contrary to the Sunshine Law. Board meetings and board discussions must be held in open meetings. They are meetings of the board, as I mentioned before. They are not public meetings. They are meetings in public of the Board of Education, and that's how they must be held. We can't have discussions about, what do you think about this policy? What do you think about this policy? They have to be had here.
I've been saying for a year that there's good reason for the law, but our ability to actually get work done, to actually do things, to actually put our heads together on stuff is severely limited by this. So this is the opportunity, and that's why, we have some of the interchange that's going on in here. We haven't talked as a group since we were last together, and I guess it was the room across the hall a week or so ago,
10 days ago.
10 days ago. So
More discussion, more questions.
Okay, so what are our choices? What are we looking at? Does anybody have suggestions? I know Eileen's.
Kathy, you need to help me with this. I'd like us to discuss the revision of 845001. I have draft language in front of me.
There are two drafts in
And
front of you.
The draft in particular that I'm more interested in, I believe, is version 2.
I would suggest, you're not going to necessarily agree with me on this, but I would suggest that the proper way to conduct a meeting like this is for someone to make a motion to revise policy 8450. And I can read that version. That does not mean that this board has to do that, but that is the proper way to enter into discussion about an item.
Do other board members feel comfortable with moving to that point?
No.
Or do we need to have more discussion before a motion is made?
Okay, so we're back to, we're going to cancel that policy and vote. I'm not hearing correctly, obviously. So I think we need to discuss what the choices are.
Yeah, I think what Kathy just suggested is that we make a motion to rescind the policy or to change the policy.
I would just make a motion I would make a motion first to amend our agenda to even consider business items. Then after that, I would also make a motion that we discuss revision of 8450.01. That if I make that motion, that does not mean that the board approves that revision. It means that I have made a motion to revise that policy. The board can discuss it. The board can make suggestions about that. The board can vote it down if
Okay.
they want the policy to stay the same.
Okay.
But in order to have something to discuss, instead of just sitting here saying, what can we discuss and when can we discuss it? My suggestion would be that we proceed in that way. Then after that, we would come to the consideration of the recommendation made by Mr. Broadwater or another recommendation.
So would it be helpful if I move to amend the agenda?
I feel comfortable with that. My understanding was that the purpose of this meeting, and I'm looking back at Mr. Jeffrey's email to us, was specifically.
The purpose was specifically to receive a report from the superintendent regarding the opening of school, especially related to COVID mitigations, and to consider the face covering policy.
And do we need to change our agenda? Because that's not specifically on the agenda, though it was in the list of the reasons.
That was simply the announcement of what the purpose of the meeting is. In order to have a vote on that, we need to amend the agenda to have that resolution on the agenda. But it is within the subject that we announced the meeting for.
I just wanted to make that clear.
Thank you. So I heard a motion from Mr. Doherty to consider revision of policy 8450.01. Is there a second? No? Oh, to amend the agenda. I'm sorry. I heard a motion from, I heard a motion from Mr.
Just
Doherty
trying to
to
follow
amend
the
the
rules.
agenda, to amend the agenda but you need a reason to amend the agenda. So amend the agenda to consider policy 8450.01.
I like that wording, and
Okay,
I'm going to
so-
adopt that wording in my
Okay,
motion.
That's a friendly amendment to your motion.
Accepted.
Okay, so we have a motion. Is there a second?
Second.
Dr. Swetch now seconded. There is a motion on the floor to amend the agenda to consider 8450.01. Can we vote on that, Mr. Giuffre?
Mr. Dougherty,
Yes.
Dr. Schweitzer,
Yes.
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 Motion carried. So we now need, at some point, a motion to consider revising 8450.01, and I will make that motion.
I second.
And Mrs. Washburn seconded. Any questions or discussion about that?
I have a question. We're discussing something that we have in front of us. Is it possible to share a screen so that other people here or online can see what we're discussing?
I was going to read my proposed revision, but I would wait to put it on the screen until in discussion, the board agrees that that's the revision they want to talk about. In other words, the motion is simply to consider revising 8450.01. I will read a possible revision. If the board is comfortable with that, then we can put it up and begin discussing it. But if the board says, no, I don't even want to discuss that one, then we'll put up some other revision. Does that make sense?
No,
No.
I'm sorry. I'm not, I'm really trying. So we just voted to amend the agenda and then,
I made a motion to
You made
consider
a to
revising 8450.01.
and why can't we see both choices?
Or any choices?
We can see them. We have
Why not?
them.
Okay,
My caution is putting them up on the screen if the board is not, if the board says they want to see those two revisions, fine, we'll put them up on the screen. The problem is we're not asking the audience to consider those revisions. We're considering those revisions.
okay. I was just thinking they would want to see what we're considering. That's all.
It's
Okay,
It's up to the board. If you want them on the screen, we can
yeah,
put them on the
and
screen.
just for clarity, were you thinking about putting up the latest revision?
Yes.
Okay, I wouldn't see a problem with putting it up there while we're talking about it,
Okay.
right? Because, people can follow along a little bit with the wording maybe that way.
I know that if I was watching at home and trying to follow along, that I would do much better if I could see what was being discussed rather than try to write it all down as I heard it.
Okay. It's just an issue of what ends up being, it's seeing the sausage.
Right, that's why I was more comfortable with you reading the later version, which I'm going to guess might be a little bit more close to the end product.
Yes. Okay. All right. So there is a motion to consider revision of 8450.01, and there was a second. Can we vote on that, Mr. Giuffre?
Dr. Lorenz,
Yes.
Mrs. Washburn,
Yes.
Ms. Pettit. Dr. Schweitzer,
Yes.
and Mr. Dougherty.
Yes.
So for purposes of discussing this motion, I'm hearing that the board would like 8450.01 version 2, which is simply a proposed revision. It is not anything this board has discussed. It is simply a proposed revision. It was designed through consultation with legal as a proper revision that would allow the superintendent authority to deal with face covering. Okay, so is it possible to put that on a screen or possible to make it public on board docs? I don't know the answer to that.
Should have it back there, right?
These are public and board docs.
Uh-huh.
I don't have board docs open.
You would have to do that, right?
My password username is not giving me access to it, but I can make it. public.
Okay, while we are working on getting it up on the screen, the board members can see it in board docs on administrative content. This is the proposed revision to 8450.01. The Loveland Board of Education is committed to providing students, staff, and visitors with a safe and healthy environment. Under existing Ohio law, local school districts may make their own determinations on COVID-19 mitigation efforts, including the wearing of face coverings, including masks and/or face shields. Given the rapidly evolving nature of the COVID-19 pandemic and the superintendent's continual monitoring of positive cases within the district and quarantine numbers, effective as of August 23rd, 2021, the board hereby authorizes the superintendent to A, institute face covering requirements as needed by building, grade level, and/or the district for students, staff, and visitors, or B, eliminate face covering requirements as needed by building, grade level, and building, grade level, and/or the district for students, staff, and visitors. In the event the superintendent exercises the authority granted under this policy, he or she shall so notify students, staff, and parents at the first available opportunity. He or she shall also notify the Board of Education of his or her exercise of authority hereunder within 72 hours so that the board can consider scheduling a meeting to review, affirm, reverse, or modify his or her decision. That would be a revision that would replace the current 8450.01, which specifically states that mask wearing in the schools is a voluntary choice of parents or guardians. In a nutshell, it is giving the superintendent the authority to either institute face covering requirements or eliminate face covering requirements. We're still trying to get it on the screen.
Making your job harder.
As soon as we can, if we can, I realize it doesn't help the folks in the room, but we could make it public content in board docs. But it's not going to help the people. Well, I guess if we pull up board docs, we can show it. Anyway, we're working on that. Board members do have that. Can we begin to discuss that revision?
I would be happy to start by saying that I personally also feel the responsibility following the last line of this policy, if we choose to adopt it, not only that the Board of Education shall have 72 hours to consider scheduling a meeting, but also that at our next regularly scheduled meeting, that topic would be specifically discussed, meaning that holds us accountable, that this was not just a Mike Broadwater decision, that we're hiding behind Mike and saying that we're not doing anything, it's him, but that we stand up in public and say, this is what we chose, or we agree with what Mr. Broadwater chose, or disagree.
So if we were to pass this, would that bring into your recommendation that would start Monday with the passage of this?
It would, and it obviously there'll be more discussion, but it would.
So we would have to get back together.
Well, I also don't think that we've necessarily determined that the current recommendation as a board is one that we've accepted. Meaning that if this policy alone were adopted without any further discussion, that's what would happen.
I think for important reasons of transparency, we should, I don't know how to do this procedurally, but we should consider Mike's recommendation. So we are saying that we're in favor of Mike's recommendation or not. I assume that by passing the resolution or the new policy that we've got here, he could go ahead and do what he said, but we would be doing it with knowledge that that's what his intentions would be. And I think we should take the opportunity to affirm it or to argue it.
Well, I
Just
would
to be
like,
clear,
oh, go
what
ahead.
do you mean by when we should take the opportunity to, are you talking about the recommendation this evening, or are you talking about any recommendation?
Well,
Because if you're talking about any recommendation, then that would mean that it couldn't be instituted until the board discussed it. So then the policy
Right. So what I'm saying
is not
is that,
nimble.
the policy, I'm sorry, I was trying to get this up on the screen and I couldn't hear while I was typing at the same time, but the policy that I'm looking at, I hope this was the one that we read,
Right.
says superintendent shall notify the board of his or her exercise of authority within 72 hours so the board can consider scheduling a meeting to review, affirm, reverse, or modify his or her decision.
Correct.
So that's the opportunity for the board to weigh in, kind of a check and balance with the superintendent potentially issuing something. I doubt this would happen because I'm sure you would call people and say, I'm thinking about this individually. And you'd have a sense of where folks were on it. But in any event, this allows the board to say, Mike, I love you, but don't agree with you on this one. And we're going to put a stop to it. It allows that to happen.
It doesn't allow the statement to Mike, if he makes a recommendation, your statement, we're going to put a stop to it. It allows us to have a meeting to discuss as a board, putting a stop to it.
Sure.
No individual board member or board members couldn't get together and
Sure.
when Mike calls, we say, oh, Mike, we don't like that, don't do it. That could not happen under
Right.
this revision.
Right.
He would have the authority to do it, and there would have to be a board meeting to discuss any modifications of
Right.
that.
And that's what this says.
Yes.
So presumably, if we had issue with Mike's intentions, like, what's the rule? Two of us could call for a board meeting
Yes.
to occur.
The board president can call a meeting, the treasurer can call a meeting, 2 board members can call a meeting. There are regulations about how quickly that meeting can be called, including notification of all board members about it.
And just to jump in, I don't think it's appropriate one person can make a decision without checks and balances. This is about a check and balance. And to Kevin's point, there aren't any decisions made without numerous phone calls and making sure that we are informing the board members. And so this is a way so that there is a check and balance and we are working together as a group.
And if we did have a ensuing meeting, we'd have to make a motion to.
In addition, I wrote down what Eric said that is a possible addition to the end of this, which was, in addition, at the next regularly scheduled board meeting, the board shall include on the agenda the face covering requirements in the district, so that it doesn't say we'll consider it, we'll affirm, we'll modify. It just says that what I believe you said, which was that it's not simply, this is going to happen, and if we want to change it, we have to call a meeting. There will be regular reports, and the board will be notifying the public of that situation at each of their regularly scheduled meetings. Okay.
And to make this more complicated,
Thanks.
because that's what I love the most, I would suggest that if this agenda item or this policy change is acceptable, that tabling it, having further discussion about this particular recommendation that's been made and whether we agree with that or not be had, and then coming back to vote for this, meaning that I am perfectly comfortable with saying, Mike, I understand you made this recommendation. We are not behind you at this time, but I am giving you the authority to change things if something changes in the future. Expecting that you wouldn't turn around tomorrow and say, yeah, you know what, nothing changed, but I decided to change it anyway. Does that make sense to explain it in that fashion?
Yeah, and that was
I
going to be
totally get
my question / comment. So, yeah.
Yeah, so I think we're working with the same thing here, that Mike's made a recommendation. None of us have talked about whether we agree with the recommendation or not. Well, you.
Sorry,
okay.
Mike.
You want a more expansive recommendation than Mike has proposed, I think, right?
Yeah.
but we have to have that conversation. Where do we stand on this? We shouldn't, I don't think we should leave tonight without having had that discussion, so we know what's potentially about to happen or not.
Oh, I don't think people in the room would let us leave tonight without having that discussion. Kevin?
I agree
Well,
with a resolution concerning Mike's recommendation. I don't want to be complicated, but I stand by my notion that we need to revise the policy before we can consider any of his recommendation.
Yeah.
It's a small point of order. And if you want to move to table, I can vote no on moving to table and we can move on with whatever happens. So that's just a point of order. That's just a point of Robert's rules.
I completely understand. And what I am saying is I am not ready to have the conversation that this is our acceptable policy and the recommendation that Mike has made is how we are moving forwards until we have another meeting. Does that make, because the way that this reads right now, once we approve it, we've also approved that recommendation.
So you're saying you don't want to approve something this evening?
No, I'm saying I don't want to approve this policy change until we've had a thorough discussion about the recommendation that Mike has made. Nor do I understand why we would have to rescind any other policies before we have that discussion.
Are you asking Eric or suggesting that we hear from Mike to see if he still stands by his original recommendation or if his recommendation has changed and then visit this policy revision?
I would not put Mike on the spot at asking him at this point to make further recommendations. He's made a very well thought out, well discussed point about why this is my recommendation as a superintendent. And I believe it's our job as a school board to either accept or reject that recommendation for now, not forever. And it's our job as a school board to change our current mask policy so that our superintendent has more flexibility to deal with situations as they change in the future.
So I think maybe I agree with what you're saying, all right? But I think the only complication with it is that, Kathy, you correct me if I'm wrong, but I don't think we have a vehicle for Mike to enact that recommendation unless we change this. So it's a little bit of the chicken and the egg kind of problem.
But are you saying though that you, and I don't disagree, that we aren't putting on Mike that tonight we would potentially revise the mask policy and then at a later date revisit the policy that we're looking at that's on the board here to then give him the authority to change, but not tonight. But tonight we would look at the mask policy.
I don't think I'm trying to make it more complicated than it is. I think that we need to change our current mask policy. I think that we need to give Mike the ability to work in a more expeditious fashion in response to changes in the situation. I don't think that approval of this policy necessarily indicates where the board stands on that policy,
On the recommendation.
on that recommendation.
I still have a question of your timing. If you ask to table this revision, are you asking to table it until we have discussion about the recommendation this evening? Or are you asking to table it? You said something about another meeting.
No, this evening.
Okay, I'm sorry, I misunderstood. So you can make a motion to table discussion about the revision and then enter into discussion about the recommendation. Then my suggestion would be we then need to bring the revision back to the table before we affirm or approve another recommendation. Is that what you were asking for?
You are way smarter than me, but that's it.
Okay, so you need to make a motion to table.
Before I make a motion to table, do we feel comfortable with the added sentence that you had read that I had suggested?
And the sentence was, in addition, at the next regularly scheduled board meeting, the board shall include on the agenda the face covering requirements current in the district.
Yes. Because when we bring this back from being tabled, I don't want people to forget that.
Okay,
Do we need to have
that's
more?
if we table it.
That's if we table it. Do we have more discussion about that? Okay. then I move to table this until we have further discussion about the actual recommendation, realizing that we'll have to approve this before.
There's a motion. Is there a second?
Second.
Okay, there's a motion and a second to table. That's not discussable. So, Mr. Giuffre, can we vote on that?
Dr. Swissman,
Yes.
Mr. Doherty,
Yes.
Pettit,
Yes.
Mrs. Washburn.
Yes, so, yes.
How do you really-
That's no, no. I believe the motion carried if a guess so. Well, I think there was a 3 yeses, so the guess so is kind of somewhere in the middle.
Are you affirming
All
or
right,
abstaining?
so the motion is tabled.
The thing,
Discussion about the recommendation.
I think there's
What?
something left here.
It doesn't,
it's okay, because it would be discussing this and we've tabled it, so.
right, we tabled it for the moment. Now, I've been asked for discussion concerning superintendent recommendations for masking. What do y'all want to discuss?
Do you guys want me to talk more?
No.
I mean,
I think you made, I'm sorry, I wasn't being rude.
Uh,
I think you made your point clear.
Did you still want those 2 resolutions public?
Say that again?
Like those 2 resolutions public? Section 4.
At the current time, the version 2 should be public in board docs. Thank you.
I need to make sure that we all feel comfortable that we're going to be able to discuss the recommendation that Mike made and what our thoughts are about that.
I'm not ready to go there yet as far as that recommendation is. That's one person's opinion.
What do you
Michelle, I
mean you're-
apologize. I didn't hear what you
Yeah, you
said.
said
I
you're
even
not ready.
unmuted.
Did you say you're not ready to go there yet?
I'm not ready to, yes, Mike's recommendation, I'm not ready to,
You're not ready to agree to that.
correct,
So
that's
you
the
would
word.
not be supportive of Mike's recommendation
At this time,
tonight?
correct.
Okay.
For the reasons that I've already said, I also wouldn't be supportive of that at this time. Although, again, I don't want that to at all
Right.
feel like I'm undermining you, because that's not my impression.
Not at all.
I feel very strongly that you've done everything that you can to protect our families and to make sure that our schools run as safely and efficiently as possible. And I need you to know that you have my support if situations change and you see a need for change.
Thank you.
I echo that sentiment. I've never gone against the superintendent's recommendation, and that doesn't mean I don't respect that recommendation.
Mhm.
This is a very difficult situation, as we've established. I think there's merit in that suggestion, but to me, not today.
So Mike, maybe just to, I'm generally in favor of this, okay, but let me, let's go back over what the recommendation is, how soon it would be implemented, how it would be implemented. There's nuances on this. Can you talk about the
Sure.
recommendation a little bit more?
So, as we discussed, the implementation would begin on Monday. You would have pre-K through 6 would be masked. The staff, the pre-K through 12 staff would be masked as long as the classified. So basically, it would be Monday morning, our pre-K through 6 students would be masked.
So you used the waiver term, didn't you?
Yes.
So how do families handle a waiver with turning on the new policy on Monday?
Well, if this is the direction we're going, we would have the waiver available on Monday on the website, and we could get it out to families. It's a medical waiver. If there's a physician or a health expert that is saying that the student would not be able to wear a facial covering, then they could fill out that form and we would process it quickly.
So, okay, so that generates 2 more questions. One is, when you say medical professional, a psychologist would be considered a medical professional in that regard?
Yes, any health expert.
Any health expert. And realizing that it takes time to maybe get, well, I'm sorry, are we asking for a note from a health expert?
Yeah, it would be a waiver form that would be filled out.
and then
at the-
signed
at
by,
the doctor.
and then signed. So realizing that that may not happen in 24 hours, right? How do you handle the situation where a child, let's say should be waivered, but hasn't processed the paperwork? How does that actually play out?
I think like with any other student, any other child who work at the building administration, you call on Monday and you say, hey, this is the issue that we're gonna have. We'll work with our physician and meet with the building administration and see how we're gonna accommodate that student, knowing that that waiver is gonna be coming in. It's a good question, but it's like any other accommodation you have in the schools, is working with the building administration and the staff.
I don't really need to say this, but I'll say it for the benefit of the public. I've spent enough time with you to know that you're all about the kids and you're all about the families, and you're the most reasonable guy, in town probably. So I'm asking you to say out loud an assurance, if we did something like this, that it's not a flip of the switch and kids all of a sudden walk into a, kind of a stone wall and they got to do this on day one
Sure. Yeah.
while this thing is in the
So,
process.
I would say it's similar to when we had the transportation masking in the summer. It was, hey, the kids are coming in. We wanted to make it as easy as possible to transition. So the first few days, let's make sure that we are taking care of our kids. Let's get this into the schools. That gives the families the time to get the medical waiver if there's going to be a medical waiver. But it's not going to be, hey, right now, if you're not wearing your mask, you're going to the office. It's let's educate the kids, let's get them comfortable. And I will tell you, the percentage of the students in the elementary, those students, and they're all wearing masks on the buses. They're pretty adaptable to the mask. They did a great job last year. But to your point, it's letting our staff know, let's take the tension out and let's just take care of our kids and let's get this moving in a positive direction.
And just be reasonable about this, because it's, this is happening potentially on Friday night. And people need some time to react to that, right? I think those were my questions.
Okay. I would state, just for the record or whatever, that I am in favor of Mike's proposal. My only concern, as Eileen mentioned, K through 12, I do understand that 9 through 12, generally those students can be vaccinated, whereas children under 12 can't be vaccinated. And so that would be why I would be in favor of a K-6 as opposed to just saying K through 12. I do also recognize that 7 through 12 students certainly have the opportunity to do a lot more things outside of school that are not necessarily under parental control all the time as far as mask wearing is concerned. And so it feels possibly a little like, the horse is already out of the barn kind of thing to require it at the high school level. I did have 2 questions, and that is that students who ride the bus are still required to wear masks.
Correct.
And that has been extended past September 13th. And so our students K through 8, pre-K through 8 would be wearing masks on the bus.
Correct. Yes.
Our 9 through 12 students are not, unfortunately, able to be bused, so it's not a question there. And then my second question was, I think you had mentioned your intention somewhere to consider this weekly, so that this is not a mandate that you are making. In other words, how we get out of this is also to consider the same kind of data, the same kinds of situations that you're considering to institute a mask requirement is also allowed by the possible policy that we're considering, how to get out of that.
I would call it, for lack of a better term, what's the exit strategy? When you mask, the goal's not to stay masked forever. How are we going to move forward to where we can get to where the students aren't wearing masks? And right now, today, this evening, I believe the medical experts have said there's a surge. And so it makes sense in a week or two. If it starts to fall, then we look at what we can do. But that's the rationale, and it was listening to medical advisors.
So I guess I would make the argument that if we're listening to medical advisors and we have some of the top experts from children's, why we wouldn't follow all of their advice, why we're kind of picking and choosing what to follow.
Absolutely valid question. What my response would be is when I look at these kids, I look at them as my children, and the vaccinated students, when I hear that 99% of the individuals in the hospital are unvaccinated, I think our push should be to strongly recommend those students get vaccinated. And I know it's a family decision. So I think there's an extra tool in the tool belt that allows us, and what I would say also, Eileen, is it allows us those vaccinations, if in a week at the grades 7 through 12, we see, you know what, the chart that we shared with the quarantine and the positives, that chart's going in the wrong direction, then we have to make a decision there as well. My hope is that that would not be the case. I think the quarantine rules help us out, as was evidenced today with the one situation we had at the high school. But it's a valid question, and it's one where, as somebody who's not a medical expert, I look at it and see, I want our kids to enjoy school. I want our kids to be safe. I want them to learn. I need them in school. The unvaccinated students, the only tool they have in their toolbox to stay in school and not quarantine is by wearing a mask. The kids at the secondary, the 7 through 12, they can get vaccinated or wear a mask, and they probably are not going to have to quarantine. So that's my rationale, but your question is a valid question.
Yeah, I guess well, obviously I don't know. I respectfully don't agree with it, because if we're asking the medical experts, then we should listen to what they're saying. The other thing I would say is that you said reevaluate in a week, which I think is great, but I think that we've seen how quickly this spreads, and in a week, a lot of things can happen with this virus.
Sure.
So Mike, do you have currently any data that would inform us on the degree of vaccination amongst the upper grades?
We're putting out that survey, and
Right.
we're going to see how the families participate. The athletics on final forms, the percent, what were we sitting at, about 50? I would say 50-55%. I can update that
That's
percent.
within, I'm sorry, what community
That was
is
the
50%?
athletes, simply because when
Just
they fill out
athletes.
on final forms, OHSA has an option where you can go on and say that you've been vaccinated or not.
Right.
So
So that would-
that's where we are with knowing the percent.
So this,
And that would just be students who are playing fall sports, and it was an optional
Correct,
question. So I don't know how valid
correct.
that data is.
well, it's limited data for sure, right?
Yeah.
Because it's just a sub-segment,
Mhm.
right? So in and of itself, it may not be informative. I know that I don't know if it's state level, we're seeing 35% vaccination rate.
That's what Governor DeWine said was 35%.
Yeah. So, I'm a little, I don't know, maybe optimistic. This is the way I think about the upper grades being different. You look at the community reaction to a request to voluntarily mask. And we got very good, not perfect for sure, but pretty good response. And I don't know the reasons that people decided to mask their kids. They had a dozen different reasons potentially to choose from. But at the end of the day, good majority of them decided to do just that. And then you have the stark contrast with the upper grades. Totally different picture.
Sure.
And there's a part of me that wonders whether parents said, I already have this covered. I don't need to worry about masks because I already took care of vaccinating the kids, at least in large numbers. Now, it's just total supposition, and data would really be helpful on this. But if my supposition is kind of in the ballpark, the distance between, where we're at right now and something that really makes a difference may be closed fairly rapidly, especially with asking parents to take another look at this and if they can get there, up here, get there, because it'll help everybody. And maybe we'll end up in a pretty good place there without having to worry about the masks in the upper grades.
Right. I agree. We can work on the survey. It's going to be optional, so the data, will not be empirical, but it will give us a pretty good indication. It's also going to help with contact tracing if we have to do it, to where we can let students go right back to class if we have the verification of vaccination.
Yeah. I mean, none of this is perfect. There are holes in everything that we're doing.
The purpose of a recommendation for me is to have discussion. These are good discussions. And we all want to do what's best for kids. And at the end of the day, we want them safe, and we want to listen to our community. And the amount of emails I received, the amount of respectful emails that would start off and say, welcome to Loveland, and then go into all the different studies. There's studies out there that I've read, and I read every single one of them. These are not easy decisions. So if we need to take our time to do it, we need to take our time to do it.
So somebody tell me if I'm wrong, looking at the Ohio Department of Health website, and I can share the link in a minute. You can filter by county and age group, and looking at all of Hamilton County, obviously, it says that the under 19 population, they're only at a 16% vaccination rate. So and Claremont's at 17%, Warren County's at 22.84%. Those numbers concern me because, like I said, the numbers that we see from the very small population that of parents who chose to answer that optional question on final forms, I don't think is representative of what's going on in
It's
high
a sample,
school.
but no, it's not totally representative.
I've looked at that data, and I had a lot of trouble understanding some of those percentages.
Yeah, my question is, because it says 0 to 19, are they counting just from
Eligible age.
Yeah,
Yeah, I'm not sure they are.
that's why I said, correct
So-
me if I'm wrong, because I don't know.
And that's
from
a
this
question I
site.
have asked, and I've asked Hamilton County Public Health to have more specific. It would be nice to have age groups and also children's. We are going to look at it next week. Hopefully they come with that data, but it would be nice to know what the breakdown is.
So where are we?
I guess,
Parents missing.
I don't know what the mechanism for doing this would be, but assessing the board's position on the recommendation.
I'm gonna do like a straw poll.
Because I guess if the flow of this is that we've had this conversation and we end this conversation and we take the policy revision back into discussion, right? The board will be informed about whether Mike's recommendation would become operative or not in deciding to agree to the new policy or not. So does that make sense? I would like to know where the board is on Mike's recommendation, because I think, well, I don't know. Say again.
Michelle thinks we all.
I think
answered.
we all answered, but
Well, except that I heard 2 and 2 clearly. And then Eileen, don't mean to put you on the spot, but I gotta. Eileen has said that she wants something more aggressive. Is she willing, or more comprehensive, I guess? Would you be willing to support this?
The current recommendation?
Yes.
No.
So you would vote no on it? Which has the effect of it failing.
Right. Likely. I'm not committing to that.
You're about
Okay,
to find
well, we,
out.
I guess.
Okay, well, let me ask it this way. If that is not going to, whether it is or it isn't going to pass, what does that mean to the tabled resolution?
Do we
In
need
other
to,
words, what's the,
Well, for me, I would tell you up front, it wouldn't make any difference on the tabled resolution, because I
It
think the
would not
tabled
for me either.
resolution is right.
right,
But if anybody has a hesitancy about approving the tabled resolution because they think, they're supportive of or not supportive of Mike's recommendation, they have a better handle on what the meaning of approving that new policy would be.
And just to make clear, because I believe that I heard this, but what I heard from you, Kevin, was that you do support that recommendation.
Yeah, you heard two things from me. One is that I would support Mike's recommendation, and the other is that I would support this new policy that we've talked about here. And they don't have to go hand in hand, but I do happen to support both of them.
But they are going hand in hand with what we have.
Well, except that if we approve the policy and we disapprove of the recommendation, what we've got is a new policy. We don't have a new plan of action.
and it's clear in my mind, if we approve the policy and then there's a vote on a resolution to approve the recommendation, if it fails, in my mind, that says that Mike needs to wait until next Friday to make another recommendation. And then the board has time to consider a meeting to approve or disapprove of that recommendation. I guess Mike could make another recommendation tonight if he wanted to, but
But to be clear, he doesn't need our approval for any recommendation once this is in place.
he doesn't, but I would assume that a superintendent would never, having heard this discussion this evening, say, well, you changed the policy, so guess what? On Monday, I'm doing what I want. I don't think that would happen.
Only to be reversed a few days later.
Right.
So that's
I
not going
just
to
don't think
happen.
that would be,
I'll have to, and to be clear, every Friday doesn't mean a new recommendation.
Right.
It's looking at the data and working with the Board of Education and seeing what we want to do for our kids. This is all good discussion. It helps me moving forward.
And I just want to add, I'm sorry, just that my biggest concern with instituting this recommendation now is not that it's not a wise recommendation. My biggest concern is that the data that we have about how Loveland Schools is currently being affected by this does not support more restrictive mandates. That could change Tuesday.
and my concern is that the data that we have from other school districts shows exactly what could happen under the current situation, what has happened in other school districts, and that it could very well happen in Loveland very
And-
quickly.
But
And with our-
Kathy, if you're,
Current policy, Mike has I'm sorry, with
go
our,
ahead.
with our current policy, with the policy that we're about to vote on, Mike has the ability to change that if things are different. And so it's not the fear of what happened in another school district as much as what has happened in Loveland, because there's other schools where there hasn't been any problems. And so I don't want to be optimistic and say, well, I'm just going to make up Lebanon hasn't had any problems, so obviously we won't. Just like I don't want to be pessimistic and say, well, Mason's had problems, so we will.
Yeah, and my concern would be the other way, that we already started school and let 3 days go by. Let's see what would happen. And the effect of not taking Mike's recommendation at this point is saying, let's let at least another 5 days go by and see what happens. And I absolutely understand your argument about not acting in fear versus, but But my concern is that that's not generally how I feel it is good to operate when you are talking about the safety of children. We had, you see the tables sitting over there, and we had tables like that that collapsed on children. We didn't stop and say, let's see if they actually collapse on children in Loveland. We said, get those tables out of the schools. So that's my thinking on it.
So can I say
Let me-
two
I'm sorry,
things? Oh,
I
go
mean, I
ahead.
keep talking over you. I
That's okay.
apologize. I don't read this policy as saying that Mike has to wait until next Friday to do something if the situation changes. Go ahead. I mean, I apologize.
No, that's okay. I was gonna say, Kathy, can you help me understand your thinking though? Because you sound like you're saying the same thing as me, but you're stopping at grade 6.
And I did explain that I felt that 7 through 12 has the option of vaccination, and that 7 through 12 has the danger of much more community contact than necessarily our younger children do. So our younger children are, I think, able to be protected by their parents, and I think it's our responsibility to also try to protect them in school.
Yeah, I guess the part I was stuck on was you're saying like surrounding districts. We're seeing what's happening, and that doesn't stop at the 6th grade. The issues are occurring at the older grades as well. And I think that then we'd be reactive and not proactive.
I think what I'm hearing is I'm not necessarily hearing support for K through 12. And I was thinking, I agree with, at the very least, a K through 6. I don't want
Is
to
there
give one
any
up. I
argument
don't want
that,
to give one up.
no, I know, I thought about what I
Because,
said before, and I probably would change what I said before, but what other information do you guys need to get from K6 to K12? Like what, I understand what you're saying, the
In this
vaccination
situation, I think
and,
it's what other information does Mr. Broadwater need from data and from medical teams, and could easily make the change under this policy. And again, I simply feel more comfortable getting a K through 6 and a little more time on the 7 through 12. And the data may very well show that there has to be a K through 12.
And I'll reiterate that to a point, which is my major concern was unvaccinated students, okay? The parent option of their student being vaccinated at the 12 and up, in my mind, provides us a little bit more time to develop data like Eric is talking about, when we know that parents have had that choice for the vaccine. Plain and simple, it would allow us. And boy, wouldn't it be great if the data came back very good. But if it came back to where we're having issues, then we could make the move there. But that was the thinking behind that.
I just think that we need to be more proactive. I mean, I know, Eric, you were talking about we can't make decisions on what may happen in the future, but I think that as humans, we do that every single day. We eat our vegetables or we quit smoking because of what may happen in the future. It's not to say all smokers get cancer, but I don't smoke because I don't want to get cancer. So I don't understand why we wouldn't be proactive and advocate for masking all of them. And I hear you guys saying, but they have the option to get vaccinated. But then Kathy and Mike both have said, but we have to listen to the medical experts, and we're not.
But you have a choice. You're making that choice.
Make it a choice for everybody though, in the building.
But you're making that choice whether you're going to eat your vegetables or you're going to quit smoking based on what the doctors are saying.
Well, that's fine then, but then we can't keep saying that we're going to listen to the medical experts.
I didn't,
No,
but,
I'm not saying you did.
but I mean, when you use that to compare, you personally were making that choice for you after listening to medical experts. So now you personally can make a choice to wear a mask. And that's what these people are saying. is that that's their choice and they're in charge of their children. So it's their choice for the children. And they have the same experts to listen to that we are listening to.
Thank you. While we're waiting for Mr. Doherty to come back, I would simply ask what the board's, pardon? I'm pretty sure he's coming back. We do have and I'm not clear on what the next step is. Do we bring back the revision to the table? And then have a vote on the recommendation?
I wanted to make sure that we had a full and complete discussion of what the recommendation and our responses to it look like before we brought this forward. I feel that that's been done. So in my mind, I'd like to see this be brought back from being tabled. We approve it. And then quite frankly, I think all of our positions have been made clear and we don't need further discussion about that, but I'm more than happy to, and to have a separate vote, just so it doesn't look like we're putting this on Mike's shoulders.
We just discussed what next steps might be. Is the board ready to bring this revision back to the table?
So moved.
We have brought, and it was Dr. Swetchenow and Mr. Doherty who brought it back to the table. I don't know I think we need to vote on that. I haven't had to do much tabling, so I'm not sure what Robert says about this, but let's vote on it.
Dr. Schwartz,
Yes.
Mr. Doherty.
I'm sorry,
You're
We're
bringing
voting
it
to
back.
bring it back to the
okay,
table.
we're untabling is all we're doing
Yes.
right now.
Yes.
Bring it back.
I'm yes on untabling.
Yes.
Ms. White
Yes.
and Dr. Lewis.
Yes. So now we have a motion to consider the revision of policy 8450.01, use of face covering masks. And it is the policy that has been displayed on the board that I have read with the addition of this statement. In addition, at the next scheduled board meeting, the board shall include on the agenda the face covering requirements current in the district.
Wait, what?
It doesn't say it there. It got added. Eric asked that it be added and I added it.
We said, is everybody okay with me?
We
adding
said,
it?
is everybody okay with it? No, we were talking about the fact that all it says, all that sentence says is at the next regular meeting, we will talk about whatever has been done, so that it's not simply, Mike does it, 72 hours go by and the board doesn't set another meeting to consider it. The public is sure that the board will be aware of it and mention it at the next board meeting, so that it doesn't just go away. It doesn't say it there. This is a sentence that I've added.
In addition to the 72.
In addition to that, yes. That's why I said in addition, at the next scheduled board meeting.
Sorry,
the board-
Michelle, this was my fault for asking us to post this and then to work off of it as something to make revisions. So I had proposed an additional sentence, which is not written on the version that you have in front of you.
And
the
it is
sentence
simply
reads-
asking that we talk about it at the next meeting, that we don't simply let things happen. Mike makes a recommendation, it happens, the board doesn't talk about it.
But we also have the option.
We do. Whatever it says there, we have that option.
We haven't taken anything away.
But it does compel us to talk about it at the next regularly scheduled meeting, even if we haven't called a meeting, even if we haven't confirmed or disaffirmed whatever Mike's recommendation is, we're still going to talk about it.
And clarify that this policy does not include his recommendation.
True.
tonight. That's
No,
needed.
It gives him the ability to do it, though.
But not Monday, unless we voted yes.
Technically, it gives him the ability to do it Monday. We have discussed that most likely as superintendent, he has no intention of going nanny boo-boo on Monday and saying, I'm doing it anyway.
But to be clear, our approval of this policy is essentially also an approval of the recommendation that he's made until we do something else.
I don't know if this was the appropriate thing to do or not, but I would intend when we're done with this policy to ask the board to take a position
Yes.
on Mike's
I agree.
recommendation, if that's a vote of confidence in his recommendation or not. I think we need to be specific about we are in it or for it or not for it.
I
At this
agree
time.
completely, and that's why I wanted to table this and then talk about it more.
Mhm.
And to be clear, we could make a motion for that and not have it pass.
True. And to be clear,
I'm good with that.
a couple of
too.
hours ago, I suggested that these were our options.
I wanted to say.
Okay,
thank
how
you
about
for
if we keep
allowing me to
moving?
make that revision.
I just want to be clear as everybody else.
Can we keep moving?
We wouldn't have had
Keep
this
moving, Kat.
enriching
Yes.
dialogue.
Are we ready to vote?
Yes.
On the revision of 8450.01?
Yes.
All right, Mr. Giuffre.
Ms. Bennett,
No.
Dr. Swisher,
Yes.
Mrs. Washburn,
Yes.
Mr. Doherty,
Yes.
Dr. Lorenz.
Yes, motion carried. I just will make one slight comment here. I do like that Mr. Giuffre pronounces Dr. Swetchenau's name differently every time he says it. So I just enjoy that.
Have
Just
fun
let
with
you know.
mine.
That's my one attempt at humor this evening. All
Kathy,
right,
would it be appropriate to, at this time, to make a motion seeking the board's confidence
Mhm.
in the superintendent's already verbalized recommendation?
yes.
All right, I so move that.
Second. Oh, all of us.
First. All right.
Who seconded first?
Who seconded first? I seconded first because I get to choose.
Okay, so now we would have this final discussion on
Yes.
that, right?
Mhm.
I mean, I've said everything I think I need to.
Okay.
Does anybody else have
I think
comments?
we've all sort of said,
I guess I'm struggling here because you said a vote of confidence in him.
No, in his recommendation, I'm sorry.
In the K through
in a
6
particular
masking,
recommendation that he made this evening.
Confidence in him.
No, well, if I said confidence,
Whenever I vote here, I have confidence in it.
right, if I said him, I misspoke. I had intended to say confidence in his
His
recommendation.
recommendation. Yes. And to reiterate, his recommendation is masking as outlined for staff, variations to masking as outlined, including waivers, and masking for, did you say pre-K through 12? Pre-K hasn't, sorry. Pre-K through 6. Pre-K has not started yet, but they will next week. Yeah, okay. So
So,
pre-K 6 masking,
right,
and then all of the other things that he outlined.
right. So speaking in favor of the motion, I view this as being imperfect but appropriate. It's not as much as the K through 12 obviously would be. I'm not sure I could get to the K through 12 at the moment. But I can get to believing that this is an appropriate move, given some of the uncertainty that we're dealing with and the growth. There's enough of the data there that suggests to me that the growth is coming. And I would rather be a little more cautious with this group of kids who have no other protection besides the mask, and to achieve a higher level of masking within the classroom for their safety. And that's why I would be in favor of doing this.
Any other discussion?
I would just add that I would not currently be in favor of this recommendation, but that my decision could very easily change as soon as next Tuesday. And I'm completely in favor of giving you the ability to wisely make this decision and support you as a board doing that.
did you say you're not in favor of it or you are?
No.
Okay, I just
Yes,
couldn't hear him.
question.
I'm sorry, I'll say again, I am not currently in favor of this recommendation, although I don't disagree with the vast majority of it. I only disagree with the timing of it.
All right. We ready to vote? Mr. Giuffre?
Mr. Doherty,
Yes.
Dr. Lorenz,
Yes.
Ms. Bennett,
No,
Dr. Switchnow
No.
and Ms. Washburn.
Yes.
Motion carried.
So Mike, you have with that, the board's feeling about this. So I guess that says if he decides to go ahead with it, he has the support of the board.
That's what I would say.
But it's still your call.
I will say that this evening with the vote 3-2, that's how I would proceed, because I feel the board, both POC had ability to.
I would just say, unless there's other business, and there can be no other business to come before this board unless it involves face covering policies. I would thank Mr. Broadwater for his work in his first few weeks as our superintendent, for his research and wisdom and courage. I would thank this board for their consideration of all the things that we had to consider this evening. And my sincere thanks to the audience, even though I banged my gavel a little loudly at one point. I really do appreciate both the voicing of opinions and the advocacy for your positions. It is good that we know where our community is, and I really appreciate being able to finish our work this evening. So thank you all very much.
Thank you all.
I would call for.
I move.
So moved. Second.
I was gonna say move to adjourn, but they beat me to it. So there's a motion to adjourn. Mr. Giuffre, can we vote on that?
Ms. Pettit,
Yes.
Dr. Switchnow.
Yes.
Ms. Washburn,
Yes.
Mr. Doherty,
Yes.
and Dr. Lorenz.
Maybe I'll just vote. Yeah, sure. It's okay. Thank you.
8:56.
Meeting is adjourned. Thank you all.